Doctor, what is hypertension?
Blood pressure is the force of the blood pushing against artery walls. This is a result of your heart pumping blood through your arteries. If the blood pressure rises too much, this puts a strain on your circulatory system. Blood pressure is reported as two numbers. The systolic pressure is the top number, and the diastolic pressure is the bottom number. Both are recorded as millimeters of mercury. The systolic pressure is the maximum pressure as the heart contracts, while the diastolic pressure is the lowest pressure between contractions when the heart is at rest. Normal values are usually 120/80. The American Heart Association defines hypertension for adults as 140 mm of mercury or higher systolic and 90 mm of mercury or higher diastolic. These numbers should be used as a guide only.
Doctor, what causes blood pressure to increase?
Being overweight, excessive salt intake, some medications, and lack of physical activity contribute to hypertension.
Doctor, what are the risk factors for hypertension?
More than half of all people aged 65 and older have hypertension. People with obesity, diabetes, gout, or kidney disease, heavy drinkers of alcohol, and women taking birth control pills are at increased risk. People with parents or grandparents with hypertension have an increased risk. Tension and stress do not cause hypertension.
Doctor, what are the symptoms of hypertension?
People usually have no or only mild vague symptoms. Severe hypertension can produce headaches, dizziness, blurred vision, nausea, ringing in the ears, confusion, and fatigue.
Doctor, how is hypertension diagnosed?
Hypertension is diagnosed if blood pressure is high during at least 2 office visits. The doctor may check blood pressure in lying down and standing up positions, and in both arms.
Doctor, what are the complications of hypertension?
Untreated hypertension strains the heart and arteries and in time damages them. Hypertension is a key risk factor for heart failure, heart attack, stroke, and eye or kidney damage.
Doctor, how is hypertension treated?
Benefits of treatment for severe hypertension are well known. Deaths from heart disease and stroke are greatly reduced by treatment. Many people can control hypertension by lifestyle changes, such as choosing foods that are low in salt, calories, and fat. Also, limiting serving sizes, maintaining a healthy weight, and increasing physical activity all help reduce blood pressure. People must take medicine daily to control hypertension. These drugs usually include diuretics, beta blockers, vasodilators, angiotensin-converting enzyme or ACE inhibitors, calcium channel blockers, and alpha blockers. People with hypertension should check their blood pressure routinely and be under a doctor's care.
Doctor, what are the do's and don'ts in managing hypertension?
Do maintain a healthy diet, rich in fruits, vegetables, and low-fat dairy products with less saturated and total fats. Do maintain a normal body weight. Do regular aerobic physical activity such as brisk walking, at least 30 minutes per day, most days of the week.